Hello, hello, welcome back. This is Psychadjacent, and I'm your host, Dr. Thomas Hughes. I am again very happy to be back for another week. The only announcement I have for today is that as of yesterday, March 17th, it's going to be a different day for everyone listening to this, obviously, but as of yesterday, we are now opening back up Los Angeles. Very exciting times that will likely change my schedule, as I'm sure it will yours. I'll keep you all posted on updates for the show. But speaking on the pandemic, here with me today is Dr. Bhuiyan. Say hello to the people, Dr. B.
Hey, how's everyone doing?
Ready to get started?
Let's do it.
All right, let's get to it. And we're back. Again, with me today is Dr. Mohammed Bhuiyan. We graduated from the University of Miami together way back in 2015. He did his internal medicine residency at the Palm Beach Regional Campus of the University of Miami. He is currently the Senior Associate Consultant in the Division of Internal Medicine at Mayo Clinic in Minnesota, where he teaches medical students and residents and sees patients from all over the world. How you doing today, Dr. B?
I'm doing well. How are you?
I'm good. I like I just told people, I got the email from the gym that I go to that everything's open back up. You just got to wear a mask. But I've been waiting on that for months. I'm super surprised. I thought this was going to take another 6 months for Los Angeles to open up.
Oh, I hear that. I have a gym in my apartment and I had just gotten a personal trainer and was just started making some personal progress when they shut everything down. And it just opened back up recently. So I share that sentiment.
Are you going to keep the trainer?
Yeah, trainer is digital. They're actually in
Oh,
Florida,
okay.
sending me workouts to do and tracking my heart rate through the fitness apps and things like that. So keep it going.
Yeah, I've been recommending people to get a trainer. I think I need to get one too. I know how to do some exercises, but they know way more than I do. So I need to go to an expert. Okay. We digress. Anyway, okay. So getting back to the pandemic, I invited you on here because I know that you have been integral and following everything related to the pandemic for the past year or so. So I wanted to speak with you just to get a brief update on the current status of the pandemic and also speak a little bit about what was going on during the pandemic. Okay, so right now, what has your role been, or what is your role during the pandemic? What have you been up to?
Right. So about a year ago from today, we actually made the decision to shut down all of our outpatient practices and elective procedures because of the surging numbers across the country and across the world, which is not an easy decision to make, but a lot of other healthcare institutions had to do similar things. And I was asked by my leadership to become the co-director of what is now called the COVID Frontline Care Team, which is Mayo Clinic Rochester's pandemic telehealth response team for Mayo Clinic Rochester and the Mayo Clinic health sites in the Midwest. So essentially, anyone who tested positive for COVID-19 at a Mayo Clinic site in the Midwest came to our shared in basket, and they would be contacted by a physician or PA, nurse practitioner, to inform them of their positive result, to risk stratify them, and then give them any advice on, hygiene and social distancing and anything that's related to their personal health. And then they would have nurse follow up to make sure that they were improving. And we would triage people, stay at home, come be seen in person at our COVID care clinic, or actually you're sick enough that you need to be in the emergency room. We also put patients that were considered to be high risk of adverse outcomes on remote patient monitoring so we could check their vital signs, through a telehealth process. I have not actually cared for any patient in a face-to-face manner with COVID-19, but I've certainly participated in the care of over 1,000 patients virtually. I was on hospital backup during the anticipated surge after Thanksgiving and Christmas 2020, and it never actually affected us I know it affected a lot of other places across the country, but we never had the surge we were expecting. So I was never actually activated for hospital backup. So that is something that the audience should know, that I never participated in the care of patients that had an active COVID-19 infections in person, but I did a lot of virtual care and had a lot of multidisciplinary meetings with infectious disease and pediatrics and other important members of the team to do this. And then other roles that I've had during the pandemic include educating our division on COVID-19. It was a new disease a year ago. A lot of people didn't know about it. I gave a divisional grand rounds on the most up-to-date data. And then we also had medical students that were stranded because they couldn't come on site to learn. So I created, with a physician from Mayo Clinic in Jacksonville, a virtual curriculum for med students to learn about COVID-19 so they could be prepared for it when they were allowed back on site. And I've done a number of podcasts and external interviews on the topic. So that's kind of what I had done for about 8 months since the pandemic really started in the United States in about March 2020.
Well, that's a lot. That's not.
That's a lot.
That's a lot. Well, you know what? What popped up into my head when you mentioned some of the things you were doing with the medical students. Many of our discussions are about elementary, middle, and high school students and how I guess their education has been slowed down socially, and obviously the basic academic aspect of it. It's just been slowed down. Would you say that the medical student training has been affected by not being able to see patients in person?
No, I think absolutely. I think it's a great point that you brought up. I'm glad that you brought that up. And I mean, you and I both know that the experience is the best teacher. And when you have hands-on experience with an actual patient, not a simulated patient or a theoretical patient, that's when you learn the best, is when you can tie what's in your textbooks and your presentations to real life examples. So I think they definitely missed that, because when we were allowed to do inpatient teaching again, once we felt comfortable with the safety protocols and the numbers, the students appreciated gratitude that they were even available to see some patients, because I always apologize to them if I can't find them, good cases, or, the hospital has a lot of COVID, so we can't see some of those patients. But if we see one or two patients and they learn something, they seemed very appreciative of that fact, just to have that kind of interaction again. So I think they did suffer for a time period, but I think things are changing where they're allowed to see patients again across the country. And I think I've mainly been amazed at sort of their positive outlook after everything, because the one thought that I had when all of this was going on is I can't imagine being in training when this is happening. I can't imagine being a medical student, can't imagine being a resident physician during this, when you're talking about taking your boards, learning how to be a doctor, and everything is just blown out of proportion. And we luckily finished our training, and we're still early in our careers, and it's challenging, but I can't imagine, being, just starting residency and then this happening. So I've kind of been blown away by the resolve of some of these students and residents throughout this process, and kind of their positive outlook. And what I've repeatedly told them, like, you're going to be better prepared for any, any event in the future than any of us were. So, treasure this experience as much as you can, with all the negatives that come with it. Take the positives, that whatever life is going to throw your way in the future, that you're going to be well prepared to handle that. So.
Yeah, well, just speaking on preparation, I would say Mayo is regarded as one of the top hospitals in the country. So big ups to you for being an employee there. How long did it take Mayo, you and your colleagues, to realize, oh crap, this is something that we're not really prepared for? How long did it take?
Yeah, so there were several discussions, I think, in January about the potential of a pandemic, and activating, the hospital incident command center, and finding the leaders in infectious disease and hospital practice and outpatient practice to start planning, what are we going to do when employees start getting sick and our patients start getting sick?
So you all started in January.
We were thinking about it, right?
Thinking about it, okay.
Funny story, I was actually in Hawaii at a conference learning about influenza vaccine, but the physician, who's well-renowned, used to work for the CDC, who was giving that conference, started talking about COVID as well, and what it means. And throughout the next couple of weeks, he was like, oh, you can prepare for the pandemic. And then within the next couple of weeks, he did a podcast on it. He's like, now I'm actually concerned about a pandemic. So, we were thinking about it, I would say in January, February, we were starting putting together committees. And I think in March is when they made the challenging decision to really close everything down for, I think what ended up being 2 to 3 months before we were felt comfortable opening up again. Obviously, the hospital was still open for emergencies and for COVID patients and things like that. But as far as outpatient elective services, those things were closed. And then we had to find strategies on how to deal with dialysis patients and patients receiving chemotherapy to make sure they didn't have any delays in care. But yeah, I mean, we started talking about it in January, and it really started to kick into gear as the numbers started to worsen, and we really started to understand more about how fast this virus is spreading and what kind of complications are going to come with it.
How would you say, because you were involved in the planning for a lot of the things that you all did, how would you say morale was when those actual plans were implemented?
So, I didn't really start becoming part of the discussions until, mid to late March when we were making the decision to close down. But I can tell you when that decision was made, there was a lot of uncertainty about being furloughed, about salaries, and I don't think Mayo Clinic's ever been in a position like this before, like many other healthcare institutions, to shut down. I mean, because we have patients coming from all over the country internationally. So this was, what is this going to do to our practice? Like, how are we going to recover from this? There was a lot of uncertainty, from my colleagues, coworkers, allied health staff, all those kinds of things, and just not being able to go to work daily and just being at home, just wondering what's going to happen. Are we going to get furloughed? Are the salaries going to be cut? Am I going to get let go? Like these kinds of things were all going through people's minds. Are we ever going to be able to come back to normal from this? Because at this time, there's no vaccine or anything like that. This is all just starting. So morale at that time, I would say, it was uncertain. There was a lot of anxiety, fear. But I think with the caveat that we're not New York City, we're not South Florida, we're not LA, we're not Houston. So we have 100,000 people or so that live here. So we're not population dense, major urban center that really got hit hard during the pandemic. So, I think part of that, we probably felt a little bit safer from that standpoint, that we weren't a densely populated area. But I think morale was challenging at that situation.
So talk to me, what was the most difficult time period during the pandemic and why did it stand out to you?
Yeah, it's hard to pick one, but what I would say is probably the time period between mid to late April and the end of May. In that time period, particularly in Minnesota, is we started seeing COVID outbreaks in the meat processing factories that we have here. And the reason that that was so challenging is, one is the numbers that we started to see daily and quickly realized we didn't have the staff to keep up with it in a timely fashion. And then the second part of that is a lot of the individuals that work at those institutions are, they have English as their second language, or they don't speak English at all. They're undocumented, or they're from immigrant communities, minority communities. So trying to reach out to those populations, there's a lot of mistrust with large institutions and healthcare institutions, and there's a lot of cultural barriers and cultural competence issues that you have to overcome, and health literacy. And you're trying to do this with a medical translator, and you're also doing this via telephone, right? So you don't have the body language, you don't have the face-to-face human connection there.
Right.
And trying to, talk to all of these people and making sure that the correct things are communicated to them with a translator is challenging, because you have to get a translator on the phone before you talk to these patients. Patient has to answer the phone, and then you have to be able to communicate. And then if they're sick patients and we want to follow them, our nurses also have to call them, which means they also have to get a translator. And for things like Spanish and Somali, which we have a lot of translators readily available for those languages, but I can tell you that there is a lot of languages out there that I was very ignorant of and that are probably uncommon in most of the United States, from some Eastern Sub-Saharan African languages, Southeast Asian languages that I had never heard of before the pandemic. And trying to get translators for those languages, sometimes you're waiting 30 minutes, 20 minutes, or an hour or longer. And you're seeing that some of these patients have comorbidities that put them at high risk, and they're going to work. And trying to contact them and say, don't go to work. And also you have these diseases, we need to monitor you. And to communicate all of that, via translator that you're waiting for, and making sure that there's a cultural element that you're overcoming, is challenging. And we had to reach out to other healthcare institutions that had relationships with these communities, because there's already a level of trust there. And then we had to talk about handouts that need to be translated in the most common non-English languages that we encounter, so we can give people some written material as well. And then kind of some of the things that you alluded to, why this might be a challenging pandemic for a lot of people, is that employers don't necessarily understand this either, and they need their people to come to work.
Right.
And when you're talking to a patient through a translator and they tell you that you're telling me to stay home for 14 days or 10 days or whatever it may be, obviously that number changed throughout time, but I'm not going to get any money if I don't show up to work.
Right.
And if I don't have any money, how am I going to pay for food and my house and electricity? And you're sitting there as a physician in an air conditioned room that's getting, salaried, and your job's not in danger, and you're talking to somebody saying you need to stay home for 10 to 14 days through a translator because you have a virus and we can't spread it. And they're telling you about their economic insecurities. So now you have to think about, well, how do we connect with the employers so that they're on the same page?
Right.
We had to develop a system of standard templated letters that the patients could bring to their employer saying, look, I have COVID and I need to stay home for this prescribed amount of time that's recommended by this healthcare team. And I need you to make sure that I can keep my job and not get let go because of this. So that's a hard conversation to have. And then to have that conversation hundreds of times, that weighs down on you, over time. And then, what really became apparent is this pandemic just ripped the Band-Aid off of all of the socioeconomic inequalities in this country, in a way that you could probably have anticipated. But now you're dealing with people that have poor access to healthcare, poor treatment of their chronic, medical conditions, and now they have COVID, and you're trying to coordinate care for them, and they're asking you, well, is this phone call going to cost me money that you're doing?
They're worried about everything. Yeah.
They're worried about everything, right? And you're thinking, I got to control this virus, I got to make sure they're safe, but they have all these other concerns that maybe our narrow healthcare view didn't really think about. So now you have to think about, man, I got to partner with the public health department and the social services departments to get resources to people, because I'm telling them you need to wear gloves to take care of your infant child and all of these things. They don't have gloves. They don't have masks.
Right.
So how do I get these people masks? What good is it to give recommendations that they can't use? So that part became really challenging. And then the numbers just kept rising. You kind of get into this period where you feel like Sisyphus. You're trying to push this boulder up the hill and it just keeps rolling back. And if you can imagine, you look at this in basket of positive COVID results, and your team was working from 6 a.m. to 6 p.m. and changing shifts, and you're holding a pager overnight, getting phone calls about sick patients, and you're bringing that number of positive results down, wake up the next morning and it's back even higher than what it was previously. And that was a continuous trend.
Right.
And it's just you're just thinking, this is not sustainable.
Yeah.
We need more people, but do we even have enough people to do this? And and then I got burned out, which I wasn't anticipating. And I'd never experienced it, from that standpoint before. And I struggled with the burnout because you and I have colleagues that are in the ERs, in the ICUs, in the hospitals. I had a friend who's an ICU fellow in New York who texted me, I'm drowning, right? And I'm sitting here, what right do I have to feel burned out when I'm not the ones that's in New York City in the ICU?
Right.
So I struggled with that, and I had to talk myself into it that my concerns are valid, that my work-life balance got thrown out of whack. And I'd been doing the same thing for 6 to 7 months at that point, almost feeling like a telemarketer at some point, repeating the same phrases. I tracked my own statistics at one point, and I had called over 1,200 people, which doesn't even account for, all the nursing phone calls and the pages in the middle of the night about, patients that are decompensating. And I'm sitting there thinking about all the different people that you talk to, pregnant patients, patients that are breastfeeding, patients that have cancer getting chemotherapy, double organ transplant, bone marrow transplant, dialysis patients, elderly, young, people that are taking care of family members with developmental disabilities or parents with dementia. And what about them? What do I do about them? And you don't realize that there's a cumulative effect of all of those conversations and all the work and the odd hours that I wasn't working before and struggling with that in myself. That's part of the reason why I got a personal trainer. All of that became extremely difficult for me because I'd never felt that way before.
Right.
And I felt guilty feeling that way because my colleagues are in the ICUs and the ERs and the hospitals, donning and doffing PPE, getting rashes from that. And I'm sitting here, not at high risk, sometimes remote teleworking at home, doing this. And like, what right do I have to feel burned out when my colleagues are out there on the literal front line? So I struggled with that. That was difficult. I know I wasn't the only one, but I got a lot of support from leadership, and I got counseling. I got a personal trainer. I saw a nutritionist, saw a dermatologist for my hair loss. Right, so I do some self-care there, and I was able to bounce back and shift gears from that. But no, that was certainly challenging. And then I'm in Minnesota now. I'm a South Floridian at heart, but George Floyd happens, right? And I watched all 8 minutes of that video the morning before work, and that was horrible. And then all the mass protests start happening. My wife works in Minneapolis, and seeing all of that, and then thinking about systemic racism and how it impacts the healthcare system, and seeing people marching in a pandemic, and you're damn right you should march for this, but at the same time, public health standpoint, it's like you're spreading this infection, so you have like these dual things going on in your mind.
Yeah.
And then you zoom out even further, and you think about all the adverse healthcare effects that people have had as a result of systemic racism over millennia in this country. And you think about that, and you're like, well, this is bigger than COVID. But COVID's in the immediate mind, and that still in my mind, maybe that the numbers are going to go up after all these protest marches, of numbers that were already increasing and things like that. So all of that was very, very challenging, from working in this environment, but also like dealing it on a personal level. And then I've had family members that got sick for COVID and non-COVID related reasons, so like dealing with all of that in the background, all of that was extremely challenging, and I've never in my entire life, thankfully, felt like that before. And like I said to you before, it's struggle because I have no food insecurity, I have no income insecurity, I have a salary. Those are not, those issues are not something that I needed to worry about. But I also had to accept, internally, that just because other people have, worse situations than yourself doesn't make your problems invalid. This is, your reality. So your problems are valid to you and your reality. And I struggled with that for some time. And I think that's why it took me so long to really realize that I was burned out, and then to seek the care that I needed for that. So I would say that time period, when all of that stuff was happening simultaneously, was definitely the most challenging. And then after the fact, we did get more staffing support, got support from leadership to sort of diversify what I was doing on a daily basis, teaching medical students, seeing patients again when we allowed patients to come back to our practice, and then ultimately transitioning into a different role, was helpful. But I know people we're in this healthcare culture where it's like, suck it up, team player, this is your calling, you signed up for this, you got to do it. Everyone's struggling, but it makes it very easy to not want to speak out, to not try to advocate for yourself. And I was lucky enough to have leadership that was listening and listened to me when I spoke up. And they even told me that not many people were willing to do what you did, to admit vulnerability, especially during a time like this. So I think that time specifically was extremely challenging for me, just from what's going on in our country, the place that I call home, what's going on with, from a healthcare standpoint, and then just from a work standpoint, feeling dissatisfied with work. When before the pandemic, I was so happy that I came to work here because the work-life balance was great, and then it kind of just flipped upside down. But that was certainly the most challenging part. I know it was a long answer, but
what you spoke on there is something that I think we've all struggled with. It's that how it is when you actually get a break and you relax, and then you get mad at yourself for not working. Oh yeah, we punish ourselves all the time. So punishing yourself for being in a safer environment than some of our colleagues makes perfect sense to me. I completely understand it. But yeah, your problems, if you have a problem or you have a concern, that doesn't invalidate other people's problems or other people's concerns. And you're saying it took you a while to really come to that understanding?
Yeah, no, I would say it took me a couple months because I was probably feeling that way longer than before I started to voice it. And my wife was telling me, she's like, you look worse. I can tell that you've changed, because I was really excited in the sense of like when we first started, not excited about the pandemic, but
Right.
excited of this telehealth operation that we were building from scratch. I thought it was a very interesting project, and there was some nationally published data that came out that said our outcomes were more favorable nationally and internationally, and it was inpatient and outpatient. And I know that the program that I helped build partially responsible for those numbers. And ultimately, we cared for over 25,000 patients virtually. And I can feel proud that I put in the effort to help build the process that took care of all those people. But you deal with this thing of intangibles versus tangibles versus intangibles. So intubating a patient that's crashing is very tangible, I would say, because you're stopping them from decompensating, and maybe they recover after the fact. Stabilizing critically ill patients, very tangible care for a patient. But doing virtual care doesn't always feel that way, especially when it's non-video and it's primarily through telephone.
Right.
So I think coming to grips with that took me some time. And once I came to grips to that, I realized that I was burned out. I was hating work. I was dreading carrying the pager, overnight. I was not enjoying what I was doing anymore. And those are all signs of burnout. I wasn't taking care of myself. I wasn't shaving, right? And part of that, is not getting a haircut because of the pandemic, but also just wasn't doing the self-care. I didn't gain the COVID-19, but I did gain weight, during the pandemic.
Were you more irritable and
I was
sleep and all
definitely
that?
more irritable. I think I was like sort of lashing out for some of my colleagues, not like in a professional setting, but like more on a personal setting. Like, why would somebody say this? I was like, little things in there would just like set me off. So, it was definitely like tough, because even in the hardest parts of residency, I don't think I ever felt the way that I did during that time period. I would say 6 to 7 months into the telemedicine operation that we set up. And I also felt guilty about, I was one of the individuals that started to build this project. And I'm somebody, I believe your name is your resume. And, if my name is on something, I want it to be of a certain quality. And if I'm going to start something, I usually want to finish it. And here I was going to my boss and saying, I need to get out. Like, I need to step away because I'm unwell mentally. And they heard me and they pulled me out sooner than I asked to be pulled out, actually. And I'm very grateful for that. And I told my boss after the fact, after I recovered, was that if you didn't pull me out, I think I would have become clinically depressed. Like, because
Yeah.
I noticed how I felt after getting removed from that role, upon my request, and transitioning to direct patient care and things like that. And even the people close to me said, you look completely different, like a different person. I had some mentors like, it's like, yeah, you look well now. So it was clearly showing physically on me too. So yeah, that was certainly challenging, but I'm kind of glad that I went through the experience, because should it happen again, I know what to do, and I know not to wait on it. And the counseling that I sought, they told me, after I told them that kind of whole story, like I just told you, they paused and listened to everything I said, and they said, thank goodness you advocated for yourself. They're like, you've done a great service for your patients and for this institution, but now it's time to take care of yourself. And they told me they honestly felt like I had pushed past my point of burnout for quite some time, because I was so resilient. I was able to tolerate it and push forward. So they, and this is someone that doesn't know me, meeting me for the first time virtually, and to hear that a third party validate that was extremely powerful for me, because the people that know you are always going to have some sort of bias about you. But to hear someone hear my story that knows nothing of what I had done, knows nothing about me individually, say those things, allowed me to move on from that.
Yeah, the other component that, I mean, we always talk about people speaking up, and you talking about your emotions and telling other people how you feel. The other component to that is having someone that's willing to actually listen to you and validate those feelings. And that is
I'm
not
very lucky in
also,
that manner.
yeah, man, that actually might be more hard to find than actually the people that are willing to voice their concerns.
I mean, I told her after the fact that she's the best leader that I ever had, because it wasn't even just me approaching her and talking to her. She actually saw me in the hallway a couple of weeks later and saw like how I looked and pulled me aside and talked to me about, how I felt. And then I communicated with her a little bit further. So she had the emotional intelligence to sort of read body language too and realize when somebody, needs time away. And I told her, I'm like, look, I don't need time off of work. I'm not asking for, sick days or vacation. I just need to do something else for a little bit just to have some diversity. I'm one of those people where if you wanted to torture me, you would make me do the same thing over and over and over again.
Right.
Right. I'm one of those people that when I was in middle school, you give me those chapter assessments at the end of the textbook, and I'm going to get a bad grade because you're not stimulating me mentally. So, when I got put in that period, I think for a lot of people, it's a good gig. You're doing a remote job, you're getting a physician salary, and you can spend time with your kids and all that stuff at home. But for me, it wasn't ideal after a certain period of time. I needed that diversity, that intellectual stimulation, and I stopped getting that after a matter of months, and the other factors that we talked about. So I had to recognize like it's good for other people, but for you it's not. And sometimes things work well for you in the beginning, and sometimes as you go on it doesn't work so well and it's no longer a good fit, and it's okay to admit the vulnerability and step away. And I wasn't comfortable with that initially, but I became much more comfortable with that after the fact.
Well, let's add that to our list of things that we are optimistic about. Okay. I'm optimistic that in terms of preparation for the next time, or if this, well, you know what? I'm sure something like this will happen again. I don't know, 50 years from now, 100 years from now, I'm sure something will happen again. I think one thing that we will be more prepared for is the mental health aspect of a pandemic, because before we're just worried about the virus being transmitted, right? But now we know that being stuck at home is one of the things that make people worse off in terms of their mental health, depression and all that. So
No, absolutely. And you hear about this fourth phase of the pandemic, and that's sort of the mental health, either diagnosed and untreated because of the pandemic or new onset because of the pandemic. And I can tell you, seeing patients again and in residence and primary care, when you look at the list of people that are coming in, there's a lot of mental health,
yeah.
complaints on there. And it's because of the pandemic, social isolation, not being able to have face-to-face counseling or therapy, not being able to see your grandkids or your family and stuff like that. So, certainly I've always had appreciative for the individuals that devote themselves to mental health wellness, because it's something that I always struggled with as a provider to do for my patients.
Yeah, it's a time aspect for you also. It's not always time to do those sorts of things. I'm anticipating once things clear and we're all back to, I guess, the norm, we're going to see the ramifications, because you mentioned the social isolation, but there's also a lot of trauma, I think, from seeing mom, dad, uncle, whoever laying in an ICU bed. I mean, that's at any age. That's
Hmm.
traumatic in itself. So, okay. Well, Nadir, Dr. Bhuiyan, I should call you professionally.
Thank you, Dr. Hughes.
I think, yes. How does it feel 5 years later? We're all we're adults now, right? You have a
Yeah,
big time position at Mayo.
it feels weird, surreal sometimes. I think I had some imposter syndrome when I first got here, especially because I trained at a regional residency program. I think I was a chief resident, so that helped, getting recognized as an applicant for here. But my goal was like, I'm someone that it's funny to people look at me weird when they see like where I am now. Like I don't have like a ton of internal motivation or drive. I honestly feel like I was naturally gifted from my parents with a great memory, and it's allowed me to sort of coast with moderate effort to minimal effort throughout most of my life. Um, Probably step one is the hardest thing I've ever tried to do well on. Besides that, I've kind of just, obviously sick patients you take care of, but I feel like my colleagues have always, on average, worked harder than me. Um, so, for me, I had this imposter syndrome coming here, and I wanted to come somewhere where there was going to be a lot of external motivation, being surrounded by, all these great minds from across the world, across the country, and be like, look at all these people with all these accolades. You gotta try to live up to that level. So I had like this imposter syndrome when I got here, and then that has completely gone away from me because I think primarily of the pandemic. 7 months into working here as a new physician, right after a chief year, they asked me to help lead this major effort, the largest telehealth operation that Mayo Clinic has ever run in the middle of a historic pandemic. And I think that situation made me realize like your leadership values you a lot, and they've said as much to me in person. So the imposter syndrome has definitely gone away, but the whole adult thing, I still feel like a kid sometimes. I feel like I obviously have the intelligence to compete with most people here, but it's still surreal to me to just like wake up, put on a suit and tie, and like work at Mayo Clinic. You know, I'm what, 31 years old now. I guess that's not yet really that young anymore, but I feel like I still play video games, man. Like, I got a PlayStation 5 and Xbox Series X during this pandemic.
Oh yeah, I know.
Painstaking efforts. So I still do that. And I watch TV shows. I still watch superhero movies. So like some of my hobbies haven't changed. Still do martial arts, which I did when I was like a high schooler. So I do all those things. I think it'll take some time. I got one gray hair during the pandemic. I wonder if that was a result of my age or a result of the pandemic stress. I don't know. That gray hair has fallen out and has not been replaced.
Congratulations. Congratulations.
I don't know, but the rest of my hair is falling out. So I don't know. We have all these great technologies to make vaccines at warp speed, but still can't stop male pattern baldness. But
I stopped feeling like a kid when my hairline started receding. So that was 2 years ago for me. I'm fighting to hold on to my youth.
I'm gonna keep holding on as long as I can. So I don't consider myself a vain person, but the receding hairline doesn't really sit well with me.
Yeah. More on that, hopefully for the listeners of this show. I'm trying to get my my hair restoration guy to come on, and we'll talk more about that. There's a lot of stuff that guys go through that people don't talk about, and we need to talk more about saving our hairlines. That is for our mental health, the mental health of men, and saving our hairlines. That's
Sign
what I
me
think.
up for the clinical trials. Inject my scalp. I'm ready.
All right, so I want to apologize for my iMessages going off. I can't turn it off right now, but it's just, wow. How many more messages am I going to get?
I'm used to that.
Jesus. Okay, so so one thing I just want to say, I do remember you in med school, but this is before we end. I do remember you in med school. I know you say you didn't work hard, but I think you were in class every day, man. You were in the back of the class, but you were in class. You, Sam, and Dan, y'all were there, man. You worked. Maybe you didn't work as hard as you could have, but I know you put in a lot of work.
That's what it is for me. Like, I know that I could have done more. I certainly didn't spend much time in the library studying. I went to class, but I was like, I'm professional. I will show up on time. I'll be where I need to be. You talk about the work outside of the scheduled time. That's where I feel like there was room where I could have done more. But I was never the person that was always trying to get hundreds on everything. I think I actually like making mistakes because I feel like mistakes are the best teachers. So I'd rather make them on a test than on patients.
You're applying yourself now. So that's the most important thing. All the tests and stuff that we take, and we're talking about middle, high school and stuff, that's all important to a certain degree. But I think right now what you're doing, as long as you're applying yourself there, that is what's most important. So, and that's exactly what it sounds like you're doing. So no arguments there. All right. I won't hear of it. All right, man, we're going to get out of here. I actually think, wow, how many more messages? I actually think that portion of the convo, how long was that? Another 20 minutes. That was the most important part of the convo.
Yeah, I thought there was some value there.
Absolutely. So
I know a lot of people don't want to speak out about it, and I feel comfortable talking about it now that I've been through it. Maybe it'll empower someone to speak out, but I'm also lucky, like you said, that my leadership they actually listen.
We've heard of places, at least, where we know leadership does not always respond appropriately when someone complains, a valid complaint at that. So that's great to hear.
I have friends that are radiologists that had to work in the ICU during this pandemic. Like, I can't even imagine that. Like if I was doing a different field and got asked to go back to an ICU that I did in my intern year, like
Yeah. We almost ended up back in the ICU. We didn't, because thankfully, I think Maryland did a pretty good job taking care of things pandemic wise. So we didn't actually get called in. But for people listening to this is Mike and this is Skip texting me, and they won't. Okay.
looks like somebody's popular, man.
Oh my God. Anyway, yeah, so I almost got called in also. Thankfully we didn't have to, and thankfully I think the hospital overall took care of things. So yeah, man, it was just a scary time for everybody. I'm glad we're turning the corner, I hope, and maybe we'll check back in a few months and see how things are going. I think I'm just gonna like have this whole entire episode just ting 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 ting. Okay. All right. We're done. Okay. All right, later.